Hello guys, this is Dr. Mora again with some videos, and today I want to show you this case in which I want to show you how I develop it. We can see we have a severe crowding in the lower arch, and I want to show you the attachments that I use, the staging that I use, and what other options do we have for attachments probably. So you can see that we are starting with some posterior expansion to create some space before moving the canines, for example, because there are some sort of trap here between the lateral and the premolar. So we are doing, well, this one, they're going at the same time, but they are going with hinge movements, as you can see. You can see this canine, how we are giving it some sort of protrusion, distal out movement, and then mesial in movement. This premolar is rotating, and I am placing two attachments because in previous cases I have shown that is very, maybe we could put it a little bit more mesial, this attachment, and a little bit below. We need to be sure that this is not interfering with the gum, and this is to simulate some sort of cupula, which is very used in orthodontics, but it is usually used with bottom, buccal and lingual, and attached to another tooth. But this is a very good technique that has been helpful for me and is helping me to rotate premolars in a very effective way. So as you can see here, let me see if the volume is okay. Yeah, all good. So let me show you that we are expanding posterior teeth like I usually do, that I always expand from 4 to 6. In this case, we're just rotating a little bit the 7 because it's not in a bad position. And you can see that we are expanding, derotating at the same time when the rotation is ended. Maybe we can do some overcorrection and rotate a little bit more. I'm still not finished with this case, but I just want to show you the protocol that I usually use. And I start creating space. I pause some tooth before starting to move them. And I always try to do the movements separated. I do expansion or pro-inclination at the very beginning with some rotation, and then I bring back the rest of the rotation. You can see we're doing some mesial out movement, and then you're going to see some distal in movement when we're starting the retraction. And obviously, you can see how the terminate is the IPR, that when we're starting to have contacts, we perform the IPR until the contact points are accessible, not before. Now, this canine is a tough rotation for aligners. It needs to be done by distal in, distal out, mesial in movements. We can use this, some sort of attachment here, and I like this sort of attachments a little bit to the distal. Um, Actually, this is wrong. We should put this, I'm actually reviewing the case from the technician, so I'm making some adjustments. We could put it here because we're trying to make some mesial movements. Even if you're doing the distal out, the rotation is to the mesial. So it's better to place it to the side of the rotation, where the rotation is going at the end, okay? Now, I am using this large attachment because if you check the movement table, sorry, it's always open at the other side. So it's 39 degrees, and oh, I thought we had some tipping, so we don't have some tipping. So let me show you why I'm using it, because it's a very large rotation, and you can also use other sort of attachments. Some attachment that you can use could be something like this if you have enough space. This one is too large as well. I like it a lot for rotations, but usually goes with the bevel. The large bevel goes in this direction if you're trying to do a mesial in rotation, and the short bevel goes here, but you can see it's too big, and Onyx, we cannot change, with Onyx, we cannot change the size of the attachment during the alignment. So I prefer to use this other one, this large one, and it's effective also because it's a very large attachment. It covers a lot of parts of the crown, and it will help you a lot for this rotation as well. So I prefer to use this one. I also use this attachment when we're having some sort of tipping. That's why I prefer it in some occasions. And sometimes, as I said before, when I'm not able to use the red one, which I use it a lot for rotation, I prefer to choose this one. So always remember that where the rotation is going, you need to place the attachment on that side. Okay. Now, in this side, you can see some expansion attachments for this molar. It has some sort of rotation distalene, but it's not that much to turn the attachment in the direction of the rotation. In this scenario, for this premolar, we do have some sort of significant rotation, not that much to place two attachments, but as you can see, we have some rotation and expansion. That's why I'm placing this large attachment. I like to use 5 millimeter ball half moon attachment, I call them. If it's only expansion, I will place it in this direction. But if we have some distal rotation and expansion, I will place it in this direction. If we were having mesial rotation and expansion, I will place it some sort like this. So it depends where the force is going. We cannot place attachments just to place them, and we need to think correctly what attachment is the correct one and where the force is going to hit the tooth, we could say. So we can redirect the force in a way. So you can see this is rotation. It goes to the mesial distal. So I'm placing the attachment in the distal area and the other one more close to the mesial. So we can have a force hitting here and another force hitting here plus the aligner pushing forward so we can have the expansion. Same happens here. We're having rotation and expansion, you can see. And in the upper arch, it's a little bit more, we have a little bit more distal in mesial out rotations, mainly with the anterior segment. I always try to wait for the anterior teeth to move. I always create a little bit of space, moving the posterior first, not so many stages as you can see on my staging panel. I always make some pauses to create some spaces before moving the anterior teeth, even if we're having more aligners, because I like to have a good anchorage on the posterior teeth, because remember, aligners cannot move this all of the teeth at the same time. So as you can see in this scenario, we're having, take a look on this incisors, lateral incisors. I do distal out and then mesial in. Did you see that? I am not placing attachments because we have a pretty good square tooth and the aligner can work very good in these scenarios without an attachment. You can see also the canine that I'm doing mesial out and then distal in. And here I am placing the red attachment that I like a lot. And as you can see, the short bevel goes with a view to the mesial and the long bevel goes with a view to the distal. So this is very helpful for rotations of canine. I have shown you how it works and the results that I usually have, which are pretty good. You can see also the other side that I'm doing something similar with this lateral, some distal out movement, and then some mesial in, but very slight movements because we don't have much rotation. And another thing that I want to show you is have a look on this expansion. We're doing expansion with the attachment bevel to the gingiva, but at the same time, we're applying buccal root torque. Maybe you're not going to see it that much here, but if you go to the movement table and at the very end, you're going to see that we are applying for 0.93 millimeters, 6.1 degrees of buccal root torque. Over here, 1.57, maybe I should apply a little bit more, or maybe it's okay. We could apply around per aligner, 1 to 2 millimeters. It's all depending. We can apply maybe a couple of degrees more here. And also here, let me remove the gum so you can see it better. So have a look on this. How do we make the expansion and the root? Well, this is a short route, but it's going forward, it's going to the buccal. This is very important to avoid the impactation of the palatal cusp while you're expanding. If you don't do this, you will have the premolars at the end with an open bite in the posterior. So, and with the attachment at the same time, you create a force that is going to hit here and will push the premolar and avoid the premolar to pro incline and extrude, we could say, the palatal cusp. So Thank you so much for watching this video. And if you like this video, please subscribe to my YouTube channel. And if you have more doubts about how to create a good arch form, please visit my website, www.predictsmile.com, and you can book a training directly with me. So thank you so much and have a wonderful day.